Hello, everyone. Thank you for joining. My name is Lindiwe Vilakazi. I'm the health reporter with the Washington Informer, and thank you for joining me today on WIN TV. If you have a health issue or anything that you are interested in hearing or learning about, please feel free to email me at lvilakazi@washingtoninformer.com for upcoming episodes. For February 7th, it is National Black HIV, AIDS and Awareness Day. And with us today is Dr. Miranda Ward. Dr. Ward is a health equity advocate and works closely to raise awareness of health disparities that are affecting Black communities, as well as advocating for better resources and access to qualitative health for those in need. So thank you, Dr. Ward, so much for joining us today.
Yes, and thank you for the invitation. I'm excited for our conversation today.
No, absolutely. Just to get started, before we do start asking you some questions, I wanted to ask if you could please just give us a little brief story of your background, who you are, especially as it pertains to you educating residents and advocating for health equity across the district.
Yes, so some people know me as an assistant professor at GW in the School of Medicine and Health Sciences because I do teach undergraduate public health courses there, but the work that I do has never been confined to the four walls of Ross Hall, right? All of my classes are community engaged courses because DC remains my classroom. So I'm constantly bringing GW students out into the community. You know, just last week when it was pouring rain, there was a room filled with city planners, residents, environmental justice representatives, youth serving organizations, all there to talk about the city's equitable development plan for building the 11th Street Bridge Park. And I was helping to facilitate that meeting. And I definitely was like, okay, come on, I brought some GW students with me. And so one of them mentioned how, you know what, she really appreciated this opportunity because this was literally her first time east of the Anacostia River. And I think it's so important because, here I am, a faculty member at GW, right? So that's what I said. Some people know me as an assistant professor, but I'm also an executive director of a youth development pipeline called Promising Futures. I'm also a DC resident. I'm also a homeowner in DC. I'm a, former elected ANC commissioner. I serve on the mayor's, commission on health equity. So I have all of these different hats. And so it's really important to me when I do get to GW and have a conversation with my students that they don't only cross the bridge and come over to Ward 7 and 8 when it's time to engage in service. Because when they only think of Ward 7 and 8 as, that's where I do my community service, but they do everything else, wards 1 through 6. It really sets up that kind of savior mentality. It really sets up like a very paternalistic relationship. And I want them to come to Ward 7 and 8 to understand and, participate in community events, right? Come over to the Washington Ballet, right? Come and, sit down and invite your family when they come, when they come for different, times during out the semester, to actually go sit down to a full service restaurant and actually invest in a Ward 8 neighborhood. So that's who I am, a little bit about who I am, but I really appreciate the opportunity to kind of talk about my background in sociology and anthropology and public health and education, because it really comes together well in the way I think of myself as a community educator.
Oh, no, absolutely. And I love that. And you're doing so much advocacy work in the district, especially being a district resident and homeowner. And as you were stating, I know that you've been appointed to fill a seat on the Ward 8 DC Commission on Health Equity. Can you tell us just a little bit about your position and what you're kind of looking forward to accomplishing while serving on the commission?
Sure. So I wouldn't say it was a recent appointment. I mean, it was about 3 years ago. So, but I did receive the endorsement of Ward 8 Councilmember Trayon White to, for this appointment to the Commission on Health Equity. And there's representation from all of the wards. And I happen to fill the Ward 8 seat. And I'm there to represent the needs, the priorities, the strengths of Ward 8 when it comes to advancing health equity. So for those of you who don't know, DC actually has an Office of Health Equity, which is all about making sure DC residents have a fair opportunity to achieve their fullest health potential. So this means that we have to remove barriers that affect the social and the structural drivers of health. So this Office of Health Equity, they actually released the city's first and only health equity report back in 2019. And this was basically providing much needed neighborhood level data, because up until this point, all we had was ward level data, which was important because we would be able to see that there would be health differences and disparities, from one ward to the next, right? But now that we had this neighborhood level data, that we relied on census tract data, we were able to break the district into 52 statistical neighborhoods. So what we once knew was a 15-year life expectancy gap between the ward that had the highest level of income and education, which is Ward 3, and you compare that to the ward that has the lowest level of income and education, which is Ward 8. Again, at the ward level, like, oh wow, you can literally expect to live 15 years less if you live in Ward 8. But oh wait, now that we have neighborhood level data, we can actually narrow in and zero in on one particular neighborhood in Ward 3, Woodley Park, and compare it to a neighborhood in Ward 8, St. Elizabeth, and it's no longer a 15-year gap. It's actually a 22-year gap.
Oh, wow.
So that's the value of having neighborhood level data, because you get at the granular level. And so we were like, wow, like we definitely have our work cut out for us, right? And so this just so happens, speaking of St. Elizabeth, that's the part of the city that the mayor just is about to build DC's newest public hospital that's actually going to be staffed and administered by Yep. So as a commission, we've been hosting these community conversations to roll out that report, because we want residents to know, one, that this report is out here. This is how you can use it. This is how you interpret the data that we have on housing and health, education and health, community safety, right? And we also hosted a health equity summit. We provide content to the mayor's annual maternal and infant health summit. And again, the work is just ongoing, but I mainly just want to make sure that the interests and the assets of Ward 8 are amplified in every conversation, whether we're talking about policy, redistricting, community outreach, or education.
Yes, and I love that part, because especially, when we're looking at observance of HIV and AIDS Awareness Day, east of the river. So we look at the rates that we have of the diagnosis across the district, right? But we see a prevalence of such a high rate in diagnosis in the Black community, right? And we're also seeing a high diagnosis of women in the Black community, but so many women that don't actually know their status. What are some of the things that you might say in particular that kind of influence that medical barrier, if you will, east of the river, that are kind of preventing certain people from knowing their status and just feeling as empowered potentially to be able to know what their health status is and know how to be able to safely engage in their intimate life and just their health life? What are some of the things that people in these communities may be battling that are separating them from having the exposure and the education that they need?
Okay. So great question. And I know you even opened up this live stream talking about National Black HIV/AIDS Awareness Day, which is actually next week, Tuesday, February 7th. Again, it's all about increasing knowledge about the state of HIV among Black people. And this year's theme is Together We Can Make HIV Black History, which is definitely a play on the fact that, the day takes place during Black History Month. And we do want to make HIV history. So to your point, how do we do that, right? So the thing is that, yes, the rates of HIV have actually overall has actually gone down, but in the Black community in the U.S., it actually has remained the same, right? So, and it's not, it doesn't actually equally affect all subgroups of Black people. So, for example, again, yes, I'm a Black woman, so I really do get alarmed and concerned when I read that. Okay, wait, Black people make up 13% of the U.S. population, or 40% of new cases. And Black women specifically are 58% of new cases, which is double that of white women, triple that of, Hispanic and brown women. And so literally Black women, yes, we're making up the majority of the new cases. And so some people may ask, well, why? Is it because, well, there's a couple of reasons, right? Well, I feel like we don't talk enough about biology. Like there's some biological reasons to just why women actually are susceptible to getting HIV, because we're more physically susceptible to it just because of our anatomy. So there's more likely to be transmission from vaginal sex. That's one. But that really doesn't explain. That would just be all women. Why are Black women leading all of the cases? That's just like, wouldn't that affect everybody equally? And that's the difference, right? Because we're not just Black women. So we got the biology piece for being a woman, but we have the also part of us being Black women. So now what is it? Because we're Black? No, it's never been about race. It's about racism, right? So to your point about what are some of those factors, okay, how are you being treated when you go into the healthcare, clinic, right? Are you adequately being screened? Are they actually giving you life-saving meds like, PrEP, which is actually a daily pill you can take if you're HIV negative, but you're potentially having sex with somebody who's HIV positive, right? We already know that women are more likely to be exposed to intimate partner violence and may feel unsafe.
Yes.
So, you may not feel empowered to negotiate condoms or get regular testing if you don't feel safe. Then there's wider community stigma, feeling embarrassed to go get a condom or seek out testing. So that's why, it's just really important that we have conversations with that we establish a medical home and have a PCP, a primary care practitioner, so that we can get our questions answered, because we're so inundated with so much information online and with, the people in our network. So why not ask a medical expert, and get their insight on the questions that you have. And then, even what you think, this is what I know, this is what I believe, still share that with with a medical team so they can weigh in on that. But so what we can do, we can get tested annually, right? We can get, and maybe even every 3 months, depending on your risk. Talk to our sexual partners about our status, their status, what you two can do to lower your risk. And I think that, in doing that, you'll basically make it the norm to have conversations about sex, have conversations about sexual risk, ways to protect yourself during sex, as well as, HIV, PrEP, and treatment.
Got you. And I love that. Yeah, because I do notice that in the community, I think that because there's so much stigma just behind STDs in general, but especially the HIV, I think it's just a hard conversation that people tend to not have enough. I think that people are scared to get testings at times. They may be afraid of their status. If they know that they may have felt a little sexually irresponsible, or just in general, it just may not be common practice for them to be as in tune with their primary care physicians. And so I think that is extremely important, especially as we're observing HIV awareness and the rates that we have. I think that it's a heavy conversation to have as far as what can help people feel more comfortable. And as you're saying, definitely having primary care physicians that you feel are really treating you properly, that you feel like are giving you the proper assistance that you need, but also having those different practices and different facilities in communities east of the river that are going to be more accessible for people, I'm sure would also help some of the issues as far as those who are just not getting tested and not being seen enough.
Yes. There's some great. I'm sorry, go ahead.
Oh, no, I didn't mean to cut you off. Go ahead.
Oh, no, I was just because you were mentioning the, east of the river and just like understanding what resources are available. So, that's a perfect segue into really just understanding that there's so many HIV service organizations in DC, so many community-based organizations, right? So you don't only have to go and talk to your doctor or, you actually, tap into us helping us, Black organization. That's why it's called Us, right? There's Women Walker Health, right? There's all these different entities that are there's a lot of faith-based ministries that actually, have testing units that actually go around and, administer tests in a neighborhood near you. So you don't even have to, if they bring it to you, so you don't even have to go and try to where to go. And it's free testing. And it's not even limited to HIV, it's other STIs as well. And so also a couple of really great resources to just add to your arsenal is, go to HIV.gov. And the reason why you should go there is because if you go pay for, PrEP or HIV meds and all of the things, again, it lists all of the, the organizations in your state, region, area, and those entities literally help with drug assistance programs. So money should not be the reason why you're not on life-saving treatment. Money should not be the reason why you're not on PrEP, which is going to prevent you from getting HIV, because it's for HIV negative people, right? So CDC.gov is also a great resource. They have lots of visuals that you can use. So it's not, they have obviously facts and statistics, but they also actually have posters and conversation guides of well, how do I bring it up? They actually have that on the website. You also can get connected to my work on the HIV disparities research that I do, because I have a research called 2in1. And so it's all words, no numbers, 2in1.smhs, which is School of Medicine Health Sciences, .gwu, George Washington University, .edu.
Got you. Oh, that's wonderful. And your research, can you tell us a little bit just about that, about 2in1, just a little more about 2in1?
I would love to. So let me just say that all of that data that I just shared with you about, Black women being 58% of new cases and all of that, just so you know, all of that data, yes, it's from the CDC, but it's from 2019. Why would I be citing 2019 data in 2023? Because that's literally the only available data we have. Because we live in a COVID era where during COVID, like there was all this focus on COVID alone, where people weren't getting tested. And so they weren't reporting that to the CDC. So CDC doesn't have updated numbers. So all the stuff that we know right now is actually an underestimate. And we don't really know the true impact during COVID, right? So this is why my research is all about, exactly, super scary. So this is exactly why my research is about actually prioritizing HIV and COVID. That's why we call it 2 in 1. So you need to basically have people talking about HIV screening, which is having conversations, getting tested, offering PrEP, get people on treatment, and talk about COVID vaccines in the primary care setting. That's the one setting, okay? And we can't afford to only talk about COVID at the expense of HIV because, one, both of them are highly stigmatized. And then two, they're both disproportionately impacting Black people. And, it's the same patient populations that are, impacted by both of them. So we really should be coupling these conversations.
Oh, absolutely. Oh, well, is there in your work and with some of the people, especially that you're, helping and advocating for, are there any main things that you would want to share with people, especially as we're trying to empower people to feel comfortable, to know their status and do their research themselves? Is there anything that you'd want to leave people with and you feel is an important point to hit?
Yeah, so I want them to know too, well, there's a main thing, right? Is that even though, these type of conversations, we often talk about, okay, this is what you can do as a patient. I'm going to give some examples of things that you can do. Yes, again, we already talked about the importance of talking to your partner, establishing a medical home so you can actually have a PCP that actually knows you can establish rapport with, you can feel comfortable with. Then you can go and come prepared with your set of questions. What I do, I always, before I go and see my PCP, put questions and all the things that I, want to say in my phone. So when I'm in the exam room, after we do all the vitals, we have all the, do all the labs, they ask me if I want a flu shot, whatever, all the things. I'm like, oh, and actually, there's a couple of things I want to know. I pull it up. So, so that you don't forget, because it's a lot to remember. It's like, oh, I forgot to ask, right? So, just coming prepared. So yes, that's something that we can do as patients, but that's the thing. The onus is not only on us. Like the patients gotta, come with questions. They got to do the research. They got to make sure they get the appointment. They got to pay for it. And they got to navigate racism at the same time. It was like all these things. So we're not putting this squarely on patients. There's a role that the healthcare system and all of the, the practitioners in it have a role in this too, which goes back to the work that I'm doing with 2 in 1, is we're literally putting together a training series. Like today, we hosted a grand rounds in the School of Medicine today for clinicians on how to have culturally responsive communication with their patients, right? So we are also training and having conversations on what PCPs can do. So it takes both, right? So it's not just on you what you can do. PCPs have a role and responsibility in this too.
I love that. I think it's a joint effort from the community. I see a comment, and thank you, David, that HIV and AIDS are rarely talked about like they were back in the day. And I can very much agree with that. I'm sure that you see the same as you do your research. I think that because we do have PrEP and these different resources and things to kind of help, mitigate some of the transmission issues, I think people just don't understand that even though rates may be lower, it's still a significant issue because it's still such a serious threat to your health, So it's a beautiful thing that you're doing so much work in the community to make sure that people are just aware that this is still a crisis.
Absolutely, it sure is. Right.
Absolutely. No, I thank you so much, Dr. Ward. I thank you so much for your time today. I hope that you'll be able to come back with us. I'm sure that we'll be doing more focus on HIV and AIDS awareness. So no, please come back to visit us. It's been a pleasure speaking with you.
Likewise. Thank you for the invitation and best wishes with your Friday series.
Thank you so much. Yeah. Thank you so much. And thank you all, everyone, for joining in with us today for WIN TV. And we will see you soon. Everyone have a wonderful weekend.
Okay.